Hi, I'm Erica from the Indianapolis Metaspan office, and we are here at the headquarters for Newborns in Need in Hudson, Ohio. I'm here with Kim Eldridge, who is behind the camera, Reverend Sue Tinker, who's the director of Newborns in Need here in Hudson, and Patty Drake from the Lexicomp office in Hudson. So I just have one quick question for you.
Absolutely.
How did Newborns in Need in Hudson get started?
When Newborns in Need in Hudson got started, you have to understand that Newborns in Need is a national organization, and we have chapters all over the United States. And we came into Hudson and we realized we didn't have a chapter in Hudson. So 3 years ago, we decided that Hudson would be a good location because Hudson is a community of such giving people, and it seemed like with all of our hospitals around in this area, the great facilities we have, that it would be helpful to be able to see what kind of partnerships we could make.
Sure.
So the Newborns in Need organization itself was started in 1992. And in 1992, it was formed from a need of a family that realized that at that time, hospitals maybe weren't as aware of the needs of premature babies and infant demise type situations where the baby is born either stillborn or dies very quickly.
Right.
And so the chapters formed out of that, the organization was formed, and it has just grown. And so there are several chapters in Ohio, but we are the only one in Northeast Ohio.
Okay.
And so we have been very pleased to be able to partner with hospitals and with social economical groups in the community, and also then we help individuals. So we have like 3 areas of help in particular that our chapter supports.
Okay.
So when we first started, we went to Akron Children's Hospital. They were our first client that we actually worked with. And we went to them and we said, okay, here we are, we're Newborns in Need, and we would like to help you in caring for the babies you have here. So we were put in touch with their NICU, their neonatal ICU unit. And some of the things that happened through that relationship has been that Akron Children's Hospital has actually been able to start several programs that are benefiting the babies and the parents. One of them in particular, let me reach ahead, is called a Kangaroo Sling. Now this is a program that is just, you can just see it's a triangle of fabric. And these triangles, though, are used as a bonding experience of skin to skin, where the mothers and the fathers also place the baby on their chest, and they just wrap the baby securely with the sling. Now, it's important because the babies then bond with the parents, and they have found that this really does increase the security that the baby feels and increase the health of the baby. At the time when we went to Akron Children's, they weren't even able to consider this program because they had no access to these slings. So because we were able to help them make the slings, they were able to offer the program. So this is one of the things we really are proud about and feel that we are contributing.
Yes.
Did you have individuals make those slings?
Yes, we make these by hand through donations of fabric, and our volunteers. We every month get together and we make just a variety of items. Our ladies, and even some of the men come and they love to use the sergers and things like that. They're great at it, and we get together and have a work day every month, and then they can take items home and work on them also. So this is one of those items. And
so the families of those babies, they get to keep these slings and take them home?
That's right.
Okay.
And they use these. The families can come in and get a new sling if it wears out from wash and stuff like that. We hope it doesn't, but you know, if you wash it every day, it could easily do that. So this is an item that the hospital then the mothers and the families will get and use and then keep, because they'll go home and continue this process at home. One of the other items, I don't have one here right now, is we actually make a sheet for one of their layettes. Their isolette sheets, when we went to them, it was just a simple circle of fabric, and we put elastic in it and makes a fitted sheet for their isolettes. But they actually were not able to budget for them because they were $47 a piece. Now this was also 3 years ago, and it's less than a yard of fabric. But it was one of those things that we looked at, and, you know, here are all the nurses, and they're wrapping all of the bedding they had in blankets, you know, and so you got this big bulky blanket. It's white, it's institutional white, those kinds of things. So we make crib sheets, and we donate those. So it becomes a ministry also to the nurses and the families when they come in, They're not staring at a blanket just wrapped around
Sure.
a mattress. They're now having a colorful,
Okay.
pretty sheet, and it just seems to create a nice environment.
Great.
So,
Awesome.
we also create isolette covers. We have a pattern for an isolette cover that fits. It's custom made to the isolette that they have, and also just our blankets, quilts that are long enough that cover. When a baby's in an isolette and they're born premature, they have found that the light from the rooms and things like that can actually damage their eyes.
Okay.
So they have to keep the environment very dark. And so we create blankets and quilts that are long enough to fold down on the sides and darken the environment so that the baby
Great.
is protected.
Okay. So that's your that's Newborns in Need. That's their role in the hospital setting.
Mhm.
And then you said you work with other socioeconomic
Right.
groups.
We partnered with Summit County has a group that it's called Pregnancy Care, and they're out of Talmadge, Ohio, and they are the first line defense really for babies in social economical need that we can tell.
Okay.
And so for them, we provide, we do make some items, but then in some items we collect
Sure.
handmade items. So we have a layette here that we've done. During the winter, we'll make a bunting. Okay, in fact, we've actually offered classes on this, and we invite the community to come in for our classes.
Oh, great.
And so there's a hat and a bunting.
Okay.
But we do collect just your typical onesies and
Yeah.
socks and shoes and all those kinds of things because we provide for babies who are premature through 12 months. That's what our chapter has designated to be our clientele.
Okay.
And so in that we donate every month. Then we make bibs, and these are items then that are put together either in layettes that we can put together or that the agency will put together and then forward to the family. They do all the vetting for the families,
Great.
so we don't do that.
Okay.
How do they get to hold of these families?
The families actually, in most cases, come to them. It is they're in Talmadge. Well, I'll take that back. There's two ways. One, they can be referred. Okay, so like Children's Services will refer to them. Haven of Rest, who is a local homeless shelter,
Okay.
they will refer to them. And what we found is we have worked with Haven of Rest directly, but we found that they typically go to pregnancy care. So what we have done is we backfill pregnancy care now
Okay.
and trying to streamline how everybody can get help in the best and most economical way also.
Great.
And the other piece of our social economical, we've recently just partnered with our local food bank here in Hudson, our food pantry. They collect baby food and formula and things like that. They'll pass it on to us, and then we have more of an avenue. So we maintain food here,
Okay.
and then our overstock we do pass on then to pregnancy care in Talmadge.
Okay. And that sounds to me like that is a huge benefit. I mean, I can't imagine being a single mom, which most of the moms probably in those situations are single moms, and being faced with all of the responsibilities of taking care of a premature or even a newborn,
Right.
and then on top of that, having that economic hardship and knowing that you have somewhere to go that's going to provide for you and your child. That's huge.
Absolutely. And a lot of times you talked about the moms being new. I mean, a lot of times when that premature baby comes, a lot of times it is the first baby. And so the family is really just trying to adjust. Most of them are single. They're trying to figure out how are they going to pay for everything they've just had. They've got this new baby. They want to give them the best start in life.
Right.
And so we realize that when we can offer these kinds of items, it's not just the baby, but it's the family. We're releasing this burden that really is just can be so overwhelming, and it allows that mother or that father to be a better parent then to the baby. And that's really what we want to have happen. We want to be able to provide them every possibility of being successful.
Okay.
So
That's wonderful. We are so excited to partner with you guys, and it is great to meet you. It's great to be here. I can't wait to get started and
wonderful.
get you guys some support. And I mean, Wolters Kluwer is a company that, with the health division, we do provide, information to healthcare professionals that helps save lives, and to me, that's huge. I mean, we are making an impact in the healthcare industry, but in this way, we get to make an impact in the community, and that's also really important. So we're excited. It's great to.
We are thrilled to have you be part of our network.